The father of surgery championed bloodletting for selected metabolic, skin, joint, liver disorders, and other disorders. So is this science or is it nonsense? Bloodletting has often been dismissed by modern medicine as barbaric and primitive, and in many historical contexts, that criticism is understandable given its misuse. But what many consider to be the father of surgery, he strongly advocated for bloodletting's selective use. So, does modern medicine, when viewed through his reasoning, support any of these principles? And does this invite us to re-examine the precision-based approach that this surgeon describes in the ancient world, in hopes that there might be additional principles we should scientifically investigate of his? So, who was this surgeon? It was Sushruta around 600 BC. And in this article in Annals of Plastic Surgery, he was deemed the father of plastic surgery. And to this day, modern surgeons still use his technique. He describes 121 surgical instruments remarkably advanced for their time. So if you want to do a deep dive, I'm not going to go through this slide, but it is quite interesting. So what might have been the ancient dialogue between a king and his Ayurvedic Vaidya, his Ayurvedic doctor? It could go something like this, maybe. Why do I have these belly aches, rashes, joint aches, urinary frequency, and what can I do? And the Vaidya, the doc, replies, well, amongst other causes, you consume too much animal flesh, too spicy animal flesh. It's very heating for your constitution. And based on my detailed assessment, one of the things that we need to do is removal of some of your blood. Rakta Moksha is Ayurvedic bloodletting, and it's described as useful for certain types of dirty blood, liver disorders, and for certain types of prameha, which is somewhat analogous to what we call diabetes today. It was useful for skin disorders and certain skin disorders and certain joint disorders. And lo and behold, modern medicine, we use therapeutic phlebotomy, which is the removal of blood for certain disorders, such as iron overload syndrome. And so if a person has this, they are vulnerable to the iron overload, especially if they eat too much iron-rich meats. And this therapeutic phlebotomy helps with skin issues, joint issues, fatigue, liver dysfunction, diabetes, and so on and so forth. And that's the case with various other disorders and removal of blood. I found this research to be quite fascinating about blood donation and glycemic control in pre-diabetics. So we'll see what comes of this. And in Ayurveda, they use leech therapy. And lo and behold, in modern medicine, this is FDA approved for the very, very similar reasons. So Sushruta, and in many Ayurvedic texts, they talk about Ayurvedic bloodletting, good for what sounds very similar to cardiovascular and cardiac health. So is there an overlap with what we understand about modern cardiovascular disorders and blood donation and what ancient Sushruta was saying? So is there any research on this? So, because also menstruating females, once they go through menopause, their heart disease risks go up to that of their age-matched male population. And so there's been a lot of theories, there's been mixed results, and my suspicion is whenever there's mixed results, it's because there's a subpopulation perhaps that might be benefiting. But in order to understand this question about what Sushruta was saying and if it applies to today, let's talk about blood donation. From Dr. James Blundell to Dr. Karl Landsteiner, and from Austria, and James Blundell is from England, and to the African American surgeon, Dr. Charles Drew. Their pioneering work led to recipients of blood deriving great benefit. But what about the donor, right? About heart health and donor? Well, at the very least, we know that a lot of articles talk about blood donation acts as a mini health screening. And but what about this cardiovascular benefit? That it's actually been studied, and some studies show that there seems to be a benefit to blood donation and lowering heart risk factors. Some studies did not show a benefit, and some of this could be explained by that healthy people happen to donate blood, so it might not be causal. But this is definitely a to be continued thing. So, Sushruta's ancient application and understanding, it seems that even through a modern scientific lens, he has a certain level of credibility. And while some Ayurvedic ideas may seem outlandish on the surface, they really do warrant a deeper scientific investigation because it might reveal even other insights yet to be discovered. So, thank you for listening. And if you are interested in learning more, please subscribe to my forygellowellness.com or this YouTube channel. Again, thank you and take care.